Hello, everyone, and welcome back to my channel. My name is Dr. Steele. I'm a board certified naturopathic doctor and a holistic doctor, just to name a few. Lots of education, all to benefit you in your holistic health journey. Today, we're going to be talking about how health apps really help to enhance holistic medicine. And so I will talk to you a little bit about how I use technology to really help you leverage your patient data and you to be educated so you know exactly where you are with your health. We like to say in functional medicine, we don't guess, we test. See, it's so ingrained, right? And so also too, before we begin, if you are interested in learning more about how to keep a holistic lifestyle, stay motivated, and build a holistic community, go ahead and click the link below. And we've got all kinds of amazing communities and different opportunities coming up. Okay, so now we're going to talk about health apps and how we use them in holistic medicine. So let's first talk about what a health app is, because sometimes people, are unfamiliar with these terms. So a health app would be like your Apple Health, right? That tracks your steps and your water and your sleep. Or, you can use something like MyFitnessPal, is another really popular one too. It's a free app to track your food, or a lot of times people use the Calm app, which is like, or Headspace, which is more of a meditation app. So those are health apps that can really help support your health journey, whether it's through mindset, meditation, or it's through, some sort of metric that you're taking. It's really helpful to have that tool, especially too, because your phone is with you all of the time. I absolutely love that my phone will track my steps, and there's so much information. If you have an Apple phone, definitely dig into your Apple Health information. It has tons. Once it starts to track your data, it has tons of really amazing stuff for you to read about, really good information that can be very helpful for you in your health journey. Okay, so let's talk about the Holistic Life app. So the app that we have worked on, so we have kind of two. We have one, it's more for our community where we have our courses, we have our communities that we've built out, like our holistic community, our pure Black community, and our holistic health coaching cohort. So we have these communities that are built out on the app, but then we have a companion app that you can track your food with. So the Holistic Life app Plus is where you can track your food, you can track your water, but you can also track your, health metrics, your weight, your waist measurement, your height measurements, your blood glucose, your blood pressure, your pH levels. The amount of data that we can track is endless. And it's so powerful because during COVID, where a lot of the providers were running around with a chicken with their head cut off because they're waiting for data from the CDC, many of us providers all around the country really took remote patient tracking and took this data. We're already into data from functional medicine, but we really took it and used it as an asset for patient public health education. And so when we can, catch these things far before they become a problem, because you think about it, when you go to your primary care, it's once a year. And there's a lot of things that they don't check for because their job is just to really look for and manage disease. And so if there's not a disease process present, then there's not a lot that they can do. And so again, this health app really helps you so that you can start to take your health more seriously. So what does that look like? You can track your water, you can track your meditation, are you meditating every day? You can journal in it. You can write, you can obviously complete questionnaires that I give you if you're a patient of mine. There is lots of information, there's education, there's courses that you can take. Let's say if you, need to learn more about time management, or you need to learn more about money management, or you need to learn more about how to eat healthy, or, how to heal from traumatic relationships. I really created a good assortment of courses that allow. And so those are companion courses. A person can take those just individually, courses on their own, or, it can be included as a part of like a semi-managed or a fully managed care plan when I'm working with a patient to kind of guide them through all of the patient remote monitoring information. So remote patient monitoring, how this works is, you can monitor pretty much anything. So let's look at, let's say your weight, for instance. I actually step on the scale every single morning. So I'll wake up, void, and then jump on the scale. And so just looking at this every day, what it does is it holds me accountable, to what I've done the day before. Now, I don't track my food as much as I used to in the beginning, because now I've got the hang of it and I pretty much know where I'm at, but this is another tool another metric that I look at that keeps me accountable to make sure that I'm not going over my fat or not doing enough protein or any of those things. So it really keeps me within my ideal weight. Other things that I can test for, let's say my pH levels, and I can start tracking that. So my salivary pH, maybe it starts off at like a 6 or a 5 or something like that, where I'm slowly working at it week to week. I'm checking it week to week while I'm doing more greens, while I'm doing more of an alkaline diet, and getting that number up to a 7.2. So it's a good tool for me while I'm on the journey and on the road to getting well. It's a good motivator, as well as it's a good accountability tool once you've gotten to whatever goal that you want and you want to maintain. So we use it in so many different ways. It's also really helpful when people are disassociated. And what I mean by disassociated is they're not really conscious of their health. So, you ask them specific questions. How much water are you drinking? I don't know. How much food, how many grams of protein? I don't know. These are questions that we need to know. How, on average, what's your blood pressure? On average, what's your glucose? These are all metrics that we should know. And a lot of times what happens is we outsource it. We outsource it to a doctor. We outsource it to a health center or to a spouse. And so we're not taking full ownership of our health, and therefore our health degrades. I always say, health, we're either building it every day or we're breaking it down. So in this case, we're breaking it down because we're not fully engaged with our health. Why we're not fully engaged? Because we're in denial. We're like, I don't want to look at it. It's bad. It's, because we've been conditioned to believe that anytime we look at these health metrics, there's something wrong, right? And that creates a lot of iatrogenics, which is medical trauma. But we really look at these key features in a health app to provide more personalized care. And that's what it's there for. It's there to show us the lifestyle side of actually what's going on. When I'm looking at, patient data and I'm building personalized care, I can look at their bioenergetic system, which is more of their energy, their emotions through a camera that we have, also through a device that we have as well. We can look at the genetics through full genetic testing and evaluation. We can look at the biochemistry through basic as well as advanced functional lab tests. And then we can look at the remote patient monitoring side, which looks at the lifestyle component of the patient. So we stack all these different data pieces on top of each other to create a very personalized care plan for you. And that's completely holistic. So we're looking at the mental, the emotional, the spiritual, all the different aspects that help you to come into fruition. So we put all that together, and a lot of what we can do, really, sometimes we need appointments, but a lot of times it can all be done through the app, through the messaging. I build 12-week care plans for patients. And really then if they want me to manage them with it, we can. Otherwise, they can really take it and apply these principles step by step. So many patients I've had have come into the practice from all different walks of life and all different health backgrounds. People that don't drink any water, people that don't eat any vegetables, people who are massively overweight, people that come in with bags of pills. There's all different health journeys, but the fact that these people are willing, right? Like that's the number one thing. And it's amazing because we don't build health instantly. It is done day after day after day. And so I just am really so grateful for these patients who come in and they're willing and they're ready and they're in action mode. And it doesn't have to be fast. Some patients move at a slower pace, and that is totally fine. You don't have to be, in fact, I like my slower patients than my fast patients because I know that they're really getting it and they're really embodying the work rather than maybe the faster patients that like, this is the next, big thing that they're doing, right? And so we want this to become a lifestyle, a holistic lifestyle that you can really internalize all of these different tips, tricks, and tools, but more importantly, all of the personalized healthcare information that we're able to pull from the health app. Now you're able to understand what your data means and be able to make informed choices. So really excited about that. Join our community below if you're interested in learning more. We do have a free course within that, and you can start using using the app and getting to know it. I'll eventually put together a course, like kind of a jumpstart of health tracking. Right now, we have a course that you may be interested in, which is understanding your lab work. So I know a lot of times you'll go to your primary care and they just don't have, the information for you, or they tell you everything's fine when either you don't feel fine or your labs, they have a whole bunch of reds on them and you don't know why, or they look fine and you still feel horrible. So I kind of walk you through the difference in functional versus optimal ranges and kind of slowly teach you about how to read your lab. So it's definitely a process. It's not like you're going to be a miracle, reading labs. I mean, you may, I don't know, some people maybe have a gift out there, but nonetheless, definitely thank you for tuning in. I will see you guys soon, and like, share, subscribe for more.